dear colleagues, friends, ladies and gentlemen, good evening. We are gathered here tonight to give emphasis of how to achieve successful bone grafting with a balance of proper technique and quality material. Moreover, questions such as what is Geistlich biomaterials and why Geistlich biomaterials? Tonight, these questions will be answered by our guest speaker. And to introduce our guest speaker, he obtained his Bachelor of Dental Surgery from the National University of Singapore in 1996. He was awarded his Master's in Dental Orthodontics from the National University of Singapore in 2002, and also his membership in restorative dentistry of the Royal College of Surgeons in Edinburg, Germany. He is presently a partner of a group practice restricting to implant dentistry and prosthodontics. He is also an adjunct lecturer in the university, teaching both undergraduates and postgraduates, and a visiting prosthodontist of the National University Hospital and a board member of the Graduate Diploma in Dental Implantology of the Graduate School of Dental Studies in NUS. As the director of the Institute of Advanced Dental Education and Training, formed in collaboration with the University of Frankfurt Pro Implant Institute, he lectures and conducts hands-on courses both locally and overseas on implant dentistry and prosthodontics. My dear colleagues, it's my honor to introduce to you our guest speaker for tonight, Dr. Henry Ho.
Thank you. Ladies and gentlemen, kamusta? Yeah. When we talk about bone grafting, very often it's always lead to something better, I hope, in your practice. And if I can see, with a show of hands, how many of you are actively doing implant dentistry? Nobody? Nobody here is doing implant dentistry? Oh, everybody's eating, so your hands, okay, leave your fork up if you are doing implant dentistry. Oh, good. Okay, all of you are doing implant dentistry. Fantastic. Important is that when we do implant dentistry today, gone are the days when we are dealing with just placing an implant. Gone are the days when we're talking about putting an implant and it's functional and it's not mobile. Gone are those days. Today, a new standard, a new bar has been set. We have to look at high-end quality, and when we achieve the aesthetics and even the quality, we have to ask ourselves the question, does it last? That is the question you need to ask yourself in your own practice. So when we talk about successful bone grafting, I have two important elements to discuss with you today. The first part of this lecture this evening, we'll be talking about implant aesthetics. Is it really achievable? Is it something that you know you can calculate, and as a successful practitioner, are you able to get the results because you plan it or because you're just plain lucky? Of course, I say the word lucky today because Singapore has just gotten our sands and our Genting casinos ready. So everything is luck in Singapore now. But I hope your implant dentistry is not luck. So the first part I'm going to talk to you is implant aesthetics. Is it really chance or is it expected? I'm going to share with you concepts which I think is peculiar to our population. When I say our population, we're talking about people like us, Asians. And we have a peculiar problem. And do you know what peculiar problem we have? This is a type of patient you see in your practice every day. If you're looking for an implant on the screen and you're still looking for the implant, don't bother. It's not an implant patient. It's a normal, healthy patient with a gingival biotype that we are challenged with. Indeed, more than half of our patients, or half of our patients. In fact, if you look at 100 patients of yours today, you probably find more than 50% of your patient has a thin gingival biotype. And these are the patients that are sitting in your practice, and they will come to you today asking for implants, and you have to make sure not only do you deliver, but also important when you put that implant in, you know it's going to maintain the soft tissue. And how do you maintain the soft tissue? It is something we are going to discuss this evening. On the contrary, if you look at the literature, they tell you, don't worry. In fact, 85% of the gingival biotype is going to be thick. But please, ladies and gentlemen, I hope you do not have this mindset. As much as these people give us very good literature and shows you good result, this patient pool belongs to a Caucasian population. Your patients are not Caucasian. Your patients mostly are Asians, and we have thin gingival biotype. And we are in the process right now to do a multi-center study to look at how many actually are thin gingival biotype. And these are situations you see even in normal crown and bridges that you do. So understand the challenges you have to face and the problems you're facing in your practice. Then you will appreciate what you're going to do in all your cases. If you look at this case here, it's a patient we see in our practice every day. Certainly, if you look at it, you look at the gingival biotype, you have a highly scalloped gingival biotype. You also look at the tooth, and very often these teeth are triangular in shape. In fact, right now, you can actually look at each other's teeth if you like, okay? I know you don't like to look at each other's teeth right now, but if you look at each other's teeth carefully right now, a lot of your teeth are actually triangular in shape. And when you have teeth that are triangular in shape, when they meet together, you have large embrasure space. And when you have large embrasure space, you need papilla to fill this up. And this is a situation that's very challenging for you, because when you start to lose your papilla, you are going to have black triangle, which is why you see very often, even in international lectures, when people publish and show you their results, you see the case starts off with a triangular teeth, but it ends with a square teeth. Perhaps you can recall some of the cases you have seen. We do not want to establish this kind of concept today because we know such things can be changed. We know we have good quality materials today to change it. And I'm also going to propose to you a technique which I've been doing in my practice and we've been doing for the last 4 years. I'm going to show you the result that we have achieved. And I hope when you do the same cases too, you can record the case and we can all share the idea. It's our turn to teach them. I think we have heard enough from the West. It's our turn for us to teach them something. I don't want to sound like I'm a communist here, okay? Right? But it's our turn to share our concepts. It's about time. And I hope, as esteemed colleagues here with me today, I hope you will have cases that you have and ideas with me as well. But if you look at this case where there is only a single crown, we know we can get predictable result because we know this is thin gingival biotype. When you do a crown, put a retraction cord, you are very careful. Because you know if you're not careful, you're going to get recession, right? Even for crown and bridge. We're not even talking about implants here. And you see in your practice a patient with beautiful full ceramic crowns done by you, patient's happy, walk out of your practice, love you like to bits, but 2 or 3 years later they come back, they hate you to bits because there is a recession. Very often we have to ask ourselves, what have we done right? It's okay, it's always easy to blame the patient and say, look, oh, this is poor oral hygiene. But when the patient does not have poor oral hygiene, what are you going to say? The fact is that we have to start right. And I hope this mindset is what you're going to walk home with. And not only thin gingival biotype, we will teach you concepts. So if you look at this case that we've done, we secure the soft tissue housing to support the white aesthetics, which is your ceramics and by your technician. And this has to be maintained for years. Okay? And this is something I hope you do it for your implants as well. That's for single tooth. Even for multiple teeth like this, when we're going to prepare the teeth and make multiple preparation, it's the same concept. But the fact is that when you do with teeth, you know you start off with a certain shape. You know you can end up with a certain shape, am I right? But very often when you think back, when you do your implants, you start off with a certain shape, you take your impressions, you do not end with the same shape. Because the soft tissue is not behaving like the way you want it to. Okay? And we will discover the process together this evening. Why? Why is it working sometimes and why is it not working sometimes? But if you look at this case, we prepare the teeth, we make provisionals, you check the patient's aesthetics and phonetics, and you look at function. You finish your restoration, you ask the technician to do the wax up, and you make the crowns, okay? And never take pictures like that anymore because it's very hard to find which crown goes to where, okay? This is purely for fun, for pictures. But when you finished it, you must ask yourself, can I attain the same aesthetics after 1 year, 2 years, 5 years, 10 years? You should, because you know what is supporting it is really bone and soft tissue. And the big question you ask yourself now, what happens is every single tooth now It's not teeth, but implants.